Obama promised Obamacare would relieve the stress on emergency rooms, but a new study shows that is far from the case. Correspondent Rich Edson tonight with a look at why that promise seems to have backfired.
One of President Obama's health care promises, more insured Americans, fewer emergency room visits.
We shouldn't have people showing up at emergency rooms that we end up having to pay for indirectly because we couldn't give them preventive care.
Almost a year and a half into Obamacare, it seems more insurance means more emergency room visits. That's what ER doctors say. A new survey by the American College of Emergency Physicians reports more than a quarter of emergency room doctors say the number of patients they're treating has increased greatly since Obamacare went into effect last year. Nearly half say they've seen some increase. Critics say the U.S. healthcare system has failed to produce the number of primary care doctors to treat millions more patients, leaving those unable to secure a doctor's appointment to choose an ER.
Obamacare was sold on a lot of premises, and expanding coverage in general, good idea. But if you don't have capacity in the system to adjust for that, and you don't have the right incentives in Medicaid to see those patients and get them treated effectively, you're not solving the fundamental problem.
The Association of American Medical Colleges says by 2020, the U.S. will face a shortage of about 45,000 primary care doctors. In response to the report, the Department of Health and Human Services says as people gain access to affordable, high-quality coverage, they are more likely to get the right care when they need it. For people who have utilized emergency rooms for non-emergency care in the past, we are continuing to work to reach out and provide information on how to best use their new coverage. The administration says the government is spending billions to train more doctors and nurses, especially in communities lacking affordable care. The group's survey says 70% of doctors believe their emergency departments are unprepared for a substantial increase in the number of patients they treat. Brett?